Hello everyone, welcome back. In today's session, we'll be studying about menstrual cycle or menstrual phase or menstruation or menses. All these names are same, right? So let's start. Periodically recurrent series of changes in the uterus and associated sex organs, ovaries, cervix and vagina. Normal cycle has about 28 days. We know, right? Then variations in the length of the cycle are mainly occurs due to variation in the length of proliferative phase only. Clear? So basically, if there are two phases, right? So only proliferative phase are variable. That length is sometimes it is more, sometimes it is less. That's why variation of the length of the cycle is happen, right? Now there are four phases in menses. First one is proliferative phase or pre-ovulatory phase, about 9 days. It is the period from end of menstruation, bleeding phase it is also called, to ovulation, that is 5 to 14 days. So basically after bleeding period, right? So see, it is the period from end of menstruation period के बाद से ovulation तक का जो period है उसको हम बोलते हैं proliferative phase, that is day 5 to day 14. Hope it is clear. Now coming to length of this phase is very variable, right? At the beginning of this phase, due to influence of FSH, that is follicular stimulating hormone, about 20 secondary follicles starts to grow in both ovary. Okay, so in the beginning of this phase, due to influence of follicular stimulating hormone, about 20 secondary follicles from both ovaries starts to grow. Clear? And start secretion of estrogen by thicker cells of outer wall of Graafian follicle. ओके पहले वो ग्रो हो गया, फिर उसके बाद क्या होगा, जो ग्राफियन फॉलिकल का आउटर वॉल है उसमें प्रेजेंट है थिका सेल्स. From that thicker cell, estrogen will be secreted. Clear? At about 6th day, one follicle from any ovary overgrow to others and become dominant follicles. So 2020 मान लो, about 2020 मतलब about 40 follicles. Among those 40 follicles, only one follicle from any ovary will overgrow to others and become dominant follicle, and stop growth of follicles other than that dominant follicles. So only that dominant follicle will be growing and other follicles growth will be stopped. Clear? Up to this, only dominant follicles become mature, that is also called Graafian follicle, and others start to atrophy. That shrink होके मतलब वो बाकी सारे follicle will be destroyed. Clear? Now high level of estrogen suppress secretion of follicular stimulating hormone. That thicker cell were secreting estrogen hormone, right? So now that high level of estrogen will suppress the secretion of follicular stimulating hormone, and sudden increase in LH, that is luteinizing hormone secretion, that is also called LH surge, around day of 12 to 13 days of regular cycle. Clear? So these two factors basically working simultaneously. So what is that? High level of estrogen suppress secretion of FSH and sudden increase in LH secretion, that is also called LH surge, around day of 12 to 13 days of regular cycle. Hope it is clear. Now inhibin secreted from dominant follicle also suppress FSH. Clear? So inhibin hormone also secret from dominant follicle. That may ask in exam many times that which all hormones are secreted from follicle, Graafian follicle. So that in that option inhibin also they put for destruction, but you have to remember that inhibin also secret from dominant follicle. Okay. Now at 14 days of cycle, ovulation occur from Graafian follicle and diameter more than 20 mm due to presence of LH, that is luteinizing hormone. Clear? Now the endometrium becomes thicker, 4 to 10 millimeter, and more vascular in this phase. So what is happening next? At day 14, okay, ovulation is happening from Graafian follicle due to the presence of LH hormone. Then endometrium starts to become thicker and more vascular in this phase. It is clear? Now next phase is secretory phase or post-ovulatory phase, or it is also called luteal phase, about 12 days. Luteal phase is length is fixed here, okay, but in case of proliferative phase, that length is variable. Now let's see, period between ovulation to beginning of next menses, that is 15 to 28 days. Okay, that you have to remember. So length of this phase is fixed, that is constant phase, also called, that is 14 days will be fixed. Now Graafian follicle after ovulation converts to a yellow structure, that is also called corpus luteum by influence of LH hormone. Clear? Corpus luteum secretes progesterone, estrogen, relaxin and inhibin. So all these 4 hormones are secreted from corpus luteum. Clear? Then due to effect of progesterone, following secretory changes occur in uterus to prepare endometrium for pregnancy. So now what is happening? Due to effect of progesterone, the endometrium of uterus, okay, that will be start to change, okay, and prepare for if any pregnancy is there. Let's see, enlarged uterine blood vessels and glands. Then excessive mucosa secretion, increase endometrium thickness, that is 12 to 18 millimeter. In first phase that was 4 to 10 millimeter, now it has been more thicker, that is 12 to 18 millimeter. Clear? Now coming to premenstrual phase or ischemic phase, about 3 days. Okay, so what is that? If pregnancy has not occurred, start to decrease level of all 3 hormones, that is LH, FHS and progesterone. Sorry, that will be FSH, right? Follicular stimulating hormone. There is a printing mistake. So in this stage, temperature drop due to disintegration of the corpus luteum. So in menstrual cycle, if you have remembered, first that slight temperature drop will be there, then increasing of temperature will be happening. So in premenstrual phase, temperature is dropping, right, due to disintegration of corpus luteum. You have to remember that. Now coming to menstrual phase, about 4 days. What is that? The functional layer of the endometrium starts to shed due to decreased level of estrogen and progesterone. So why this menstrual cycle is starting? See, due to the decreasing level of estrogen and progesterone, that functional layer of endometrium starts to shed off, right, which results into bleeding. Clear? Now 50 to 100 ml blood loss occurs in each menstrual cycle. Endometrium becomes excessive thin, that is 2 to 5 millimeter, because endometrium has only stratum basalis. So what was happening in luteal phase? That was that thickness happened around 12 to 18 millimeter, but in menstrual phase that endometrium thickness has been excessive thin, that is 2 to 5 millimeter. Hope you have understood this much. So let's see once again, revise that 4 phases there. That first one is proliferative phase, second one is secretory phase, third one is premenstrual phase, fourth one is menstrual phase. So what was the length now? Proliferative phase or pre-ovulatory phase, it is variable, about 9 days, okay, and luteal phase length, that is 14 days, and that is fixed one. Clear? Now that premenstrual phase, that is around 3 days, and menstrual, that is around 4 days. Clear to all of you? and also that length of menstrual cycle varies due to what is that proliferative phase, right? Hope it is clear now. Now what all are the changes and hormones are influencing in every phases that you have to remember when that Graafian follicular is developed, starts to grow, when it is shedding off the endometrium, all you have to revise once again. So now after the completion of menstrual cycle, now let's see what all are the abnormality of menstrual cycle. So let's see. Yeah, first one is dysmenorrhea. What is that? Painful menstruation which affect daily activities of client. First one is primary spasmodic pain or dysmenorrhea. The pain usually begins just before or at menarche. Mainly occur below 20 years of age. So what is dysmenorrhea? That is painful menstruation which affect daily activities of client. Primary, that is spasmodic pain. Dysmenorrhea, it is called, okay. Now the pain usually begins just before or at menarche. Mainly occur below 20 years of age. What are the causes now? Let's see the causes one by one. First one is psychogenic factor like anxiety, okay. Anatomical or functional causes. Bicornate uterus having two process or horn-like projection. If you have seen that bicornate uterus in the uterus abnormality, we will be discussing in details. Now you can remember that bicornate uterus मतलब क्या है? Normal uterus नहीं है, इसमें horn-like projections है, ठीक है? And here it is written hormonal imbalance also it is a cause. Then stenosis of internal os. Clear to all of you? That cervix के ऊपर जो internal os है ना, उसमें stenosis है, एक string है. Now increased prostaglandin vasopressin secretion in menstrual flow, which intensifies uterine contractions, resulting in increased uterine hypoxia and pain. So we know, right, prostaglandin cause pain. They are using like in general we girls also use that paracetamol, right? Why we are using? Because it sometimes subside the symptoms, because if it is due to increased of prostaglandin hormone, okay. But that should not be like मतलब जब भी पेन हो तभी तुम पीसीएम ले लिए, ऐसा नहीं है. तब तुम्हें डॉक्टर के साथ कंसल्ट करना है, क्योंकि देखो एबनॉर्मलिटी ऑफ मेंस्ट्रुअल साइकिल क्या हो सकते हैं ना, कभी कभार क्या है, कुछ इंटरनल कॉजेस के कारण में भी हो सकता है. तो यू हैव टू चेक, गो फॉर चेकअप, राइट. सो नाउ असेसमेंट पार्ट, लेट्स सी. That is pain, nausea and vomiting, vertigo and restlessness. Clear? Now how we will manage dysmenorrhea? Administer antispasmodic drugs, prostaglandin inhibitors and dilatation of internal os. All these are the management. Now coming to secondary dysmenorrhea. So let's see. Painful menses that manifest some years after menarche, mainly occur above 20 years of age. So these are the secondary dysmenorrhea. Okay, it is not happening at menarche. It is happening after some years of menarche and occurs above 20 years of age. Now what are the causes? Endometriosis, that is presence of functioning ectopic endometrial glands outside the uterine cavity, mainly into pelvic cavity. So what is endometriosis? That is presence of functioning ectopic endometrial glands outside the uterine cavity, mainly into pelvic cavity. And cervical stenosis, then pelvic inflammatory disease, uterine leiomyomatosis, that is also called fibroids, then intrauterine device. Okay, now assessment part, let's see. Pain occurs before 3 to 5 days and relief after menstruation. So when is pain happening? That is before 3 to 5 days of menstruation and relief in after menstruation. So you have to remember, this is the secondary dysmenorrhea And this is the assessment part. Now management, treating the underlying causes. What is underlying causes? All this: endometriosis, cervical stenosis, pelvic inflammatory disease, uterine leiomyomatosis, and then intrauterine devices. All these are secondary dysmenorrhea. Now menorrhagic or hypermenorrhea. What is that? Let's see. Excessive menstrual bleeding or menstrual bleeding that lasts longer than 7 days, and prolonged bleeding called menostaxis. So excessive menstrual bleeding or menstrual bleeding that lasts longer than 7 days. This is basically a hypermenorrhea, or it is also called menorrhagia. Prolonged bleeding called menostaxis. Epistaxis, say you can remember menostaxis. Epistaxis means nose bleeding, right? So we are using this suffix because of excessive bleeding. Now polymenorrhea, menstrual bleeding that occurs regularly but at intervals of less than 21 days. So menstrual bleeding that is happening regularly but at intervals of less than 21 days. If it occurs with excessive or prolonged bleeding, it is called epimenorrhagia. See, basically in polymenorrhea, what is happening? At less than interval of 21 days, then menstrual bleeding is happening regularly. It is called polymenorrhea. And if with this symptom, if excessive or prolonged bleeding is happening, then it is called epimenorrhagia. It is clear to all of you? Now coming to oligomenorrhea. What is that? That is scanty or infrequent menstrual flow. Okay, now amount is less. Cycle become prolonged, more than 35 days, and infrequent. So what is oligomenorrhea? That cycle also will be prolonged, that is more than 35 days and infrequent. Clear? Now hypomenorrhea, what is that? A deficient amount of menstrual flow but with regular periods. Okay, it is a scanty menstrual bleeding, last for less than 2 days. हाइपोमेनोरिया में क्या होता है? मतलब irregular period है लेकिन deficient amount of menstrual flow, and scanty menstrual bleeding for less than 2 days. Usually menstrual cycle का length क्या है? 4 days, 4 to 5 days, right? But it will stay less than 2 days. Clear to all of you? Now coming to metrorrhagia. What is that? Intermenstrual bleeding. Bleeding between regular menses may be associated with either benign or malignant condition. Okay. मतलब मान लो एक पीरियड जो मतलब दो साइकिल का, फर्स्ट एक मेंस्ट्रुअल पीरियड, सेकेंड में एक मेंस्ट्रुअल पीरियड, ये दोनों मतलब जो साइकिल है इसके अंदर भी और एक बार ब्लीडिंग हुआ है. सो दिस इज कॉल्ड मेट्रोरेजिया, राइट? और इंटरमेंस्ट्रुअल ब्लीडिंग. बेसिकली इट हैपेंस आइदर बिनाइन और इन मैलिग्नेंट कंडीशंस. क्लियर? Now coming to cryptomenorrhea. What is cryptomenorrhea? Monthly subjective symptoms of menses without flow of blood may be caused by an imperforate hymen. मतलब क्या है उसमें? क्या है? सब्जेक्टिव सिम्टम्स ऑफ मेंसेस है. मतलब मान लो जो सिम्टम्स है, फैटिक है, मतलब उसको रेस्टलेस फील हो रहा है, या जो मिनिमम पेन, ये सब कुछ हो रहा है बट कोई फ्लो ऑफ ब्लड नहीं है. क्लियर? एंड इट इज मे बी बिकॉज ऑफ इनपरफोरेट हाइमेन. क्लियर? नाउ एमेनोरिया और मेनोस्टैसिस. व्हाट इज दैट? एब्सेंस ऑफ मेंस्ट्रुएशन. ओके, एब्सेंस ऑफ मेंस्ट्रुएशन. In pregnancy, we know, right, that there will be absence of menstruation. That is called amenorrhea. So that is called physiological amenorrhea. See, primary amenorrhea, that is before puberty. Oh, before puberty and after puberty. Oh, it is also a point. So let's see. Failure to menstruate, lack of menstruation by age 16 due to decreased pituitary gonadotropin levels. Okay. So what is primary amenorrhea? That is before puberty. If it is happening, that failure of menstruate, that is by age of 16 due to decrease of pituitary gonadotropin levels. And what is secondary amenorrhea? Cessation of menses in women who have menstruated previously but now not menstruating since last 6 months. Pregnancy is the single most common cause of secondary amenorrhea. So basically pregnancy, what I was telling, that is secondary amenorrhea, right? And primary amenorrhea is due to decrease of pituitary gonadotropin levels. Hope it is clear. And now coming to pathological amenorrhea, that is concealed amenorrhea, that is also called cryptomenorrhea, right? Hymen obstruction we have already studied in just last slide. Congenital like cervical atresia. TVS means transvaginal septum. Acquired like cervical stenosis, vaginal atresia. All these are causes of concealed amenorrhea. Now true amenorrhea क्या है? Due to tubercular endometritis, uterine prolapse, adhesion, carcinoma, polycystis, etc. Clear? Then hormonal management में क्या है? Drug clomiphene citrate induce ovulation. This is used in case of true amenorrhea. Clear? Then hematometra, what is that? Hemorrhage in uterus and accumulation of menstrual blood in the uterus. Then hematosalpinx, what is that? Retained menstrual fluid in a fallopian tube. Then hematocolpos, that is retention of menstrual blood in the vagina caused by the imperforate hymen. So what is that? First one is hematometra. Metra means uterus, right? You can remember like that. So hemorrhage in uterus will be happening. So accumulation of menstrual blood in the uterus. Now hematosalpinx. Salpinx means we know fallopian tube. So retention of menstrual blood in a fallopian tube. And hematocolpos, that is retention of menstrual blood in vagina. Clear to all of you? It is caused by an imperforate hymen. So today we have discussed about menstrual cycle, what are the phases and its hormone effects, then duration, length, and next part we have discussed about some abnormal condition of menstrual cycle. So hope it is clear to all of you. Keep revising, keep studying, and happy learning. Thank you so much for hearing me.